Tear collection is often quite difficult due to the limited volume of tears in the first place. One method that can be used is known as the flush tear collection method. The equipment that you'll need for flush tear collection includes sterilized pipette tips, a clinical pipette, microcapillary tubes, sterile saline, a tear expeller, test tubes, gloves, a sharps container and tissues. This is the microcapillary tube that we use in our experiments. We use the end closest to the orange bar to collect tears from the temporal canthus because this is the smoother end. We know that from that end up till the black line we have a volume of 10 microliters. In order to facilitate the process of tear collection, we first instill a known volume of sterile saline into the eye using a clinical pipette. In this case, we will use a volume of 60 microliters. To instill the saline, we ask our participant to rest her head back against the chair and look all the way up. We then rest our hand, not holding the pipette, against the patient's face, or specifically, slightly pulling down the lower lid using the middle or the fourth finger. We use our index finger of the same hand to support the pipette so that we are more stable. Once we expel the saline into the participant's eye, we then ask our participant to close her eyes and roll the eyes around twice. We then ask our participant to tilt her head towards the side where the saline was instilled, then open her eyes and look up and out into the opposite direction. We then use the microcapillary tubes to collect the tears from the temporal canthus. Every few seconds we pull back, asking our participant to blink in order to prevent reflex tearing. This is done for a set period of time, in our case 1 minute. This expeller is used to transfer tears from the microcapillary tube into the test tube. To use this, cover the hole at the top with your finger and insert the microcapillary tube and squeeze the tips of the expeller to express into the test tube.